class, it's Natalie. I'm here to do my last assignment for Miss Conley and Miss Cooper. I'm going to teach you how to do a successful venipuncture. So before I get the patient, I'll go ahead and get my supplies ready. The patient has been ordered to have a PTT test and CBC. So we need to have the correct color-coded tubes. PTT is blue, CBC lavender. We have an extra tube to pull out the waste for any tissue debris or alcohol left on the site. We have our alcohol pad to cleanse, gauze, vacutainer, and the needle. So I'll go ahead and connect the needle to the vacutainer. And let's get our patient. Mr. Verdesia?
Yes.
Hello. Come with me, please.
Sure.
Then have a seat right here. My name is Natalie. I'll be your medical assistant today. Could I have you verify your name and your date of birth, please?
Eduardo Venipuncture, November 19th, 1996.
All right, great. Looks like we have the right guy. So, have you ever given blood? Had blood drawn?
Yes.
All right. Did you have any problems? Fainting? Dizziness?
No.
No. All right. Do you have a preferred arm or location?
Doesn't matter.
Doesn't matter? All right. Let's take a look and see what we have. Wow, big one there. You okay?
Okay.
All right. Wait just a moment. I'm going to go ahead and wash my hands. All right. So I'm going to use this one. So could I ask you to do me a favor and leave this hand in your arm? I'm going to place the tubes here. You want to make sure to do the correct order of draw. With the PTT and the CBC, the PTT would go first, and then your CBC. That would be after the waist, of course. All right, so the tourniquet should be about 2 inches up from the site. You want to put it on, make sure to palpate the vein. It's right there. So let's go ahead and take this off while I put on my gloves to give the patient a break. All right, reapply the tourniquet. Go ahead and palpate the vein again. Then we can proceed with the procedure. You want to cleanse it with one quick swipe. Allow it to dry for about 30 seconds. All right, when you do the venipuncture, you want to make sure that you have the bevel side up on the needle. Also, you're going to hold it at a 15-degree angle. You want to anchor the skin with your thumb. And then you're going to go in with one swift movement. You okay?
Mm-hmm.
You want to get your waist tube first. Just a little for waist. We're going to do the blue top first for the PTT. You okay?
Mm-hmm.
You want to make sure to fill it up to the correct amount, the line on the side. Once it's full, you want to gently take it out without moving the needle and insert I'm sorry, invert the tube. Do our last one. You still feeling okay?
Mm-hmm.
All right. All right, we're going to go ahead and release the tourniquet. Remove the tube. Invert. Place gauze and remove the needle. Sir, could you apply pressure?
Mm-hmm.
And do not bend your arm. We'll go ahead and cap that needle. Place that in our sharp container first. You still feeling okay?
Yep.
Let me check it to make sure you're doing all right. Looks pretty good. All right. Let me go ahead and do the proper documentation before I let you go. Your name again. I'm going to put your name, your date of birth, my initials, today's date, and the time in military time. I'm going to do this on both tubes for proper identification of the patient. It's blood. The markings I was referring to here is the line on the tube. You want to make sure the blood is to there. So then we're going to go ahead and centrifuge this. When you use a centrifuge, you want to make sure to put in the balancing tubes, one on each side, to balance the centrifuge. And then we're going to put these in and let them spin for about 5 minutes. All right. Then you want to make sure to clean up the area. Make sure your patient's still feeling good. You all right? Okay, great. Blood goes in the appropriate sharps container. You're all set. The doctor will be in touch with you within the next few days. Okay? Thank you very much. And I'll go ahead and document while the blood is spinning, the site that I drew the blood from, and the same thing that's on the tubes, the time and date and my initials.